I want you to imagine something most people never have to see. I'm in the operating room. It's a Tuesday morning. The air's cold. The monitors are rhythmic. And on my table is a 67-year-old man named Thomas. Thomas was a retired teacher. He walked 3 miles a day. He was on four different high-dose blood pressure medications. He followed every rule his doctors gave him, and yet, when I reached into his chest to feel his ascending aorta, the primary vessel that carries life-sustaining blood from the heart to the rest of the body, it didn't feel like the firm, pressurized rubber it should have. It felt like a concrete pipe. It was rigid, it was cold, it was unforgiving to the touch. Thomas hadn't ignored his health, he had followed the standard advice. But here is the tragedy: Thomas was fighting the numbers on the blood pressure cuff with pills. But he wasn't fighting the structural decay of his vessels. What I told Thomas's family in the waiting room that day is exactly what I'm going to tell you. After 60, your blood pressure isn't just about stress or salt. It's about a medical concept called vascular compliance. Today, I'm going to show you 7 surgical-grade resets, 5 specific foods, and 2 powerful drinks that act like biological WD-40 for your arteries. We aren't just going to mask the symptoms with a pharmacy. We are going to address the silent stiffening at the microscopic source. The science, the anatomy of silent stiffening. Before we open the kitchen cabinet, you have to understand the anatomy of the enemy. Your arteries are not just hollow plastic tubes. They are living, breathing organs. When you're 20, your vessels are like high-quality, fresh rubber bands. When your heart pumps, the vessel expands to absorb that rush of pressure, and then it snaps back to push the blood along. This is the definition of health. But as we age, a process the medical community calls inflammaging begins. Think of it like a slow-burning blowtorch held against those rubber bands. Chronic, low-grade inflammation acts as a catalyst, melting the elastic fibers and replacing them with stiff, scarred collagen and, eventually, calcium deposits. Think about what happens when you leave a rubber band out in the scorching sun for years. It becomes brittle, it cracks, it loses its give. That is exactly what was happening inside Thomas's chest. Pumping blood through a lead pipe takes significantly more force than pumping through a rubber one. This is why your medications often stop working or require higher and higher dosages. The pills try to slow the pump or lower the fluid volume. But they do absolutely nothing to fix the pipe itself. Today we focus on the forensic biology of the pipe. Item number 1, the fiber-first mechanical rule, food. This is the most powerful mechanical override you've never heard of. It isn't just about what you eat, but the exact chronological order in which you eat it. The rule: you must finish your vegetables completely before you allow a single forkful of protein, rice, bread, or potatoes to enter your mouth. This must be a non-negotiable law at every single meal. The forensic science. When you consume fiber, specifically the insoluble and viscous fibers found in leafy greens and cruciferous vegetables, at the very start of a meal, it creates a physical mesh across the lining of your small intestine. Why does a heart surgeon care about a net in your stomach? Because of the postprandial glucose spike. When you eat carbohydrates or sugars first, your blood sugar levels skyrocket within minutes. Your pancreas responds with a massive emergency flood of insulin. We now know that acute insulin surges don't just affect your waistline. They cause an immediate, involuntary contraction of the smooth muscles in your artery walls. Your vessels literally clench in response to that insulin flood. By putting the fiber mesh down first, the sugars from the rest of the meal enter your blood gradually. The insulin response is muted, and your arteries stay in a relaxed, dilated state. I have seen patients who changed nothing else about their diet see their post-meal blood pressure readings drop by 10 points within just 2 weeks of adopting this sequence. Item number 2, the Vascular Primer, food, celery, and arugula. If the fiber-first rule is your overall strategy, this specific salad is your arterial primer. We need to move past the idea of food as fuel and start seeing it as a signaling molecule. Arugula. This bitter green has one of the highest nitrate-to-weight ratios in the entire plant kingdom, often exceeding 2,500 milliliters per kilogram. When you chew arugula, the bacteria on your tongue convert those nitrates into nitrites. Once swallowed, these become nitric oxide. Nitric oxide is the master gas of your cardiovascular system. It is the chemical signal that tells your arteries to open up and allow blood to flow freely. Without it, your vessels stay clamped shut. Celery. Most people dismiss celery as crunchy water, but to a surgeon, it is a powerhouse of a phytochemical called 3N-butylphthalide, 3NB. "3NB specifically targets the media layer of the artery walls, the smooth muscle, and signals it to relax. It is a natural, biological parallel to pharmaceutical calcium channel blockers. The protocol: prepare a vascular primer salad using 2 cups of fresh arugula and 2 stalks of sliced celery. Consume this 10 minutes before your main course. You are essentially preloading your system with a natural vasodilator. Preparing your pipes for the massive increase in blood flow that happens during the digestive process. Item number 3, the surgical 10-minute garlic rule, food. Garlic is perhaps the most well-researched cardiovascular tool in history, yet I would estimate 95% of people are destroying the medicine before it ever reaches their plate. Garlic contains 2 separate components, a compound called alliin and an enzyme called allinase. The actual medicine, a molecule called allicin. Does not exist until those 2 components mingle. The common mistake: if you chop a clove of garlic and immediately drop it into a hot sauté pan, the heat kills the enzyme instantly. The chemical reaction is aborted, and the blood pressure-lowering benefit is lost. The surgical rule: you must thoroughly crush or mince your garlic and then leave it on the cutting board for at least 10 minutes before it touches any heat. This rest period allows the allicin to reach its peak concentration. More importantly, it allows the allicin to become heat-stable, meaning it can actually survive the cooking process. This turns a simple flavor enhancer into a genuine medical intervention that mimics the effects of ACE inhibitors by preventing vessel constriction. Item number 4, the Potassium-to-Sodium Ratio, food, white beans and potatoes. The medical world has spent decades telling you to cut the salt. But as a surgeon, I've seen that the salt itself isn't always the villain. It's the lack of its biological opposite, potassium. Your body operates on a sodium-potassium pump. Potassium is your natural pressure release valve. It signals the kidneys to flush out excess sodium, and on a cellular level, it eases the electrical tension in your blood vessel walls. The problem: most seniors in the West get barely 1,500 milliliters of potassium a day. To actually heal the concrete pipe effect, you need 4,000 milliliters. The solution: you don't need exotic supplements. A medium baked potato with skin, 900 milliliters of potassium. 1 cup of cooked white beans, 1,000 milliliters. 1 cup of spinach, 800 milliliters. By adding these potassium bombs to your daily routine, You are biologically forcing your body to excrete the fluid that is currently bloating your blood volume and hammering against your arterial walls. Item number 5. The 14-half walnut protocol. Food. We must address a danger that most standard doctor's appointments ignore: nocturnal hypertension. In a healthy cardiovascular system, blood pressure follows a circadian dip. It should drop by 10–20% while you sleep to allow the heart muscle to recover. But for many adults over 60, this dip never happens. The pressure stays high all night, hammering the delicate capillaries in your brain and kidneys while you are completely unaware. This is why the risk of stroke is statistically highest at 5 a.m. The intervention: 30 grams of walnuts, exactly 14 halves, eaten 30 minutes before you go to bed. Walnuts are biologically unique. They are the only common nut with a high concentration of alpha-linolenic acid, ALA, and omega-3 that directly reduces vascular inflammation. Furthermore, walnuts contain natural melatonin and L-arginine. This specific combination acts as a chemical stand-down order for your sympathetic nervous system. It facilitates that natural nighttime pressure drop and helps the aorta maintain its elasticity. I have seen morning spikes stabilize into normal ranges in just 3 weeks with this simple evening ritual. Item number 6, the Crimson Ace inhibitor. Drink hibiscus tea. Now we move to our liquid tools. Hibiscus, specifically Hibiscus sabdariffa, has been used as heart medicine for over a millennium. The science. Hibiscus contains organic acids and anthocyanins that act as natural ACE inhibitors. ACE is the enzyme in your body that triggers the constriction of your vessels. Pharmaceutical drugs like lisinopril work by blocking this exact enzyme. The result: a landmark study published in the Journal of Nutrition found that drinking hibiscus tea daily reduced systolic pressure by an average of 7 points in adults with hypertension. In my clinical experience, 7 points is the difference between needing an extra prescription and staying in the safe zone. The protocol: drink 3 cups a day, 1 in the morning, 1 in the afternoon, 1 in the evening. It can be hot or cold. Use a tiny amount of honey if you must, but avoid sugar, as sugar causes the very insulin spikes we are trying to avoid. Safety. Note: if you already take a prescription ACE inhibitor, consult your doctor as the combination can be too powerful. Item number 7, the endothelial buffer. Drink apple cider vinegar. Apple cider vinegar, ACV, is often dismissed as a health fad, but to a surgeon who understands metabolic chemistry, the acetic acid in ACV is a serious tool. Acetic acid does 2 things brilliantly. First, it improves insulin sensitivity. By having ACV with a meal, you blunt the blood sugar spike, which prevents the insulin clench of your arteries. Second, it has been shown to stimulate the production of nitric oxide in the endothelial cells. The Teflon-like lining of your vessels. The protocol: 1–2 tablespoons diluted in 8 ounces of water. Have 1 glass with each of your 2 largest meals. Crucial: never drink it neat or undiluted, as it can damage tooth enamel and the lining of the esophagus. Use a straw and give it 3 to 4 weeks of consistent use to see the forensic change in your blood pressure readings. The oil audit: stopping the artery shards. If you implement all 7 items but continue to cook with canola, soybean, corn, or sunflower oil, you are effectively trying to put out a fire while pouring gasoline on the other side. These vegetable oils are highly unstable. When heated, they undergo oxidative stress, breaking down into toxic compounds called aldehydes. These aldehydes act like microscopic shards of glass, causing direct, jagged damage to your endothelial lining. This triggers the very inflammation that turns your arteries into concrete pipes. The surgical switch. 1. Extra virgin olive oil. Use it for salads, low heat, or drizzling. It is a living oil packed with anti-inflammatory polyphenols. 2. Grass-fed butter or ghee for high heat cooking. Unlike seed oils, saturated fats are structurally full and stable. They do not oxidize into vascular irritants in a hot pan. This switch alone can reduce your inflammatory markers, CRP, by 25% in 90 days. Conclusion: the 6-month follow-up. Thomas, the man with the concrete pipes, came back to see me 6 months after his surgery. He hadn't just survived, he had transformed. He made these 7 changes, not all at once, and not perfectly, but consistently. His cardiologist was able to reduce his medications from 4 down to 2. His inflammatory markers had dropped. His pressure was stable. But the most important change was how he felt. He looked 10 years younger. He told me, "Dr. Liam, I feel like I finally have my life back." Your body at 60, 70, or 80 is not a broken machine. It is a biological system that is remarkably responsive to the right signals. These 7 resets are those signals. Don't try to change your entire life tonight. Pick just one. Start with the Fiber First Rule or the 14-half walnut protocol. Master it for 1 week, then layer in the next. I'm Dr. Liam Cooper. Take care of your heart. It has been working for you every single minute of your life without asking for anything in return. It's time you gave it the tools it needs to keep going. Disclaimer. Everything shared today is general health information based on clinical research. It is not a replacement for personalized medical care. Please do not adjust or stop any medication without a direct conversation with your own doctor. Your physician is your partner in longevity. Subscribe for more surgical-grade health insights. I'll see you in the next video.